And tonight we'd like to welcome everyone to the impact of dental health on future medical complications. Now, this series is sponsored by Aquarel and Phillips, and tonight's session is sponsored by the Oral Cancer Foundation and Velscope. Our guest tonight is Joanne Jones, and she's an international award-winning speaker joining the 2024 Dentistry Today CE Leaders for the 14th consecutive year. But tonight, Joanne is going to use her personal and her professional experience to share more information on dental health.
And I'm going to tell you, Joanne, we are so thrilled to have you. And the topic, again, is managing dry mouth, the importance of screening and an integrated healthcare team. And I'm going to tell you, girl, I got lived experience too. So we're so happy to have you. But before we get started, there's a couple of housekeeping things. Everybody has noticed that there's a lot of JJs on here. And so don't worry about that. You got to love when there's a glitch with Zoom. We're super blaming Zoom on this one. And so because they're not here to say they didn't. And so we're going to go ahead. Guys, if you will, the chat is working perfectly fine. Go ahead and put your questions in the chat. We'll be keeping an eye on that. And then we're also, as a reminder, we are excited to offer CEs. JJ is going to put that link to the CEs. It also can be found on our website, confessionsofareluctantcaregiver.com. It will also be sent out in the email tomorrow. So as a reminder, everybody, if you're new to the series and you're just jumping in, you're going to find after this session, we will send a follow-up email that has links to all 3 sessions that we've had thus far. You'll also have a survey. You will have a really awesome link from Aquarel for a discount for you to try it. You should definitely do that. I'll tell you more at the end, more about Aquarel. And honestly, I think that's probably the biggest thing. So we're going to jump right in. And Joanne, we're so happy to have you. So I'm like, ooh. So, okay. I'm going to start first. I would love for you to tell us about how your career evolved from being a dental hygienist to an international speaker, which is crazy. That is so cool.
Okay, well, I'm ready to jump in too and super excited. I was thinking today, there's stuff that I really enjoy in my job. There's things that I like, and then there's things that I love. And tonight is one of those things that I just feel like I love because I can talk about a subject I'm very passionate about and talk about things that work and help people. Whether we've got medical professionals, dental professionals, caregivers, patients, cancer survivors, CPAP users, whoever, we're here to help. But anyway, still a dental hygienist after 45 years. And I think in the short of it is an easy statement: adversity to empowerment. And I somehow think you two ladies might know a little bit about what I'm talking about. My world came tumbling down. I was fired from my job, from a practice, an office that I loved. And the dentist's wife, I was non-compliant with the hours that they had suggested. I had young children at home and was asked to work every evening. And I thought, that's no life. And a fairly new relationship. I had been a single mom for a while. Anyway, I don't have to go into a lot of details. It just wasn't good. So I offered to help my mom out because she was looking after my stepdad, my 2 biggest cheerleaders in life. Like, you know what it's like, your mom, your dad, your stepdad. It was just, they were always there for me. Got fired on Thursday. My mom dropped dead very unexpectedly on Sunday.
Wow.
As I get older, a really, really young age. And then my stepdad, she was taking care of him. So I had no job. I definitely had to get a job, but I spent every day with him, kind of taking over for my mom where she had left off. And he said, "What's your dream?" I said, "Well, I need to get a job. That's the first thing. I'm a contributor to the household and I need to get a job." He said, No, what's your dream?" And as we got talking about it, I said, my dream is really helping my colleagues, dental hygienists, and any healthcare professional recognize the impact they have on people's lives. It's not just a job. We have an amazing opportunity to impact quality, quantity of life for everybody that we're in touch with, everybody that we have an opportunity to communicate with. So that's kind of how all that got started. And then I just took it from there and started developing educational programs and aligned myself with some really great people.
Well, that is definitely that's just dropping in like a job change there, Joanne. That's a story. Okay. Okay. Well, you went to the job change, sort of. Now you're an international speaker, but what got you to talking about what's the link between HPV and oral? Help me with that word, Joanne. Oropharyngeal cancer. Thank
Well,
you.
put the emphasis on either syllable. It doesn't matter. But you know what? When I look back on that, it was two people that changed the trajectory of my life that I was so fortunate to be able to meet early on in my career. One was Brian Hill.
Mm-hmm.
He's an individual. I don't even have words for him. He is a superhuman being. He's super intelligent, but mixed with that, super compassionate. He's the founder of the Oral Cancer Foundation. And the second person that came into my world was Wayne Reese, who was with Velscope. Velscope is a screening device that sees beneath the surface where cancer starts, instead of waiting until the later stages where most cancers are found. And those two people changed my trajectory from impacting lives to teaching my colleagues to save lives. And that's really where that all happened. And the other thing, I could see that there was this huge exponential growth spurt in HPV related oropharyngeal cancer. And I know, Natalie, you've shared so much, about what you've gone through with your husband. And I love that, because we've got to take the stigma off of it. Like, if I asked everybody to put in the chat here right now, I'm going to ask a question and you're probably going to think, oh my gosh, this woman has no filter. I don't have
I support your no filter. I'm not going to
Go
lie.
for it, Joanne.
Good. Okay. If you are sexually active, please type yes in the chat box.
Oh.
Well, let's give them a second to weigh in. Natalie's right on it.
I'm on that. Did you notice I'm just coming right
there we
over?
go. Okay.
Did you all notice that I am saying yes constantly?
Jody is good. Jolie, sorry. And all the other JJs are. When Michael Douglas announced that he had HPV through sexual relations, it was like, oh my gosh, like he's having sex. Like, how horrible. The stigma had to come off. So that's how I got talking about, look at all the yeses. Yes. We got a happy birth with us.
Wow.
So yeah, that's how that happened.
Wow. I'm just going to pause for just a second. I know folks are coming on. There's a little bit of confusion. Jay, the chat is disabled for some folks. I just want to be respectful of the folks who are trying. I see the Q&A on the bottom. So guys, we see you and we are trying to fix this. I again am blaming Zoom. I think, Joanne, HPV is so misunderstood. And I'm just going to say that. I think that people think that is solely sexually transmitted. And I don't mind to share that when Jason had symptoms for over 9 months, that he of swollen lymph nodes in his neck, that he couldn't figure out what was going on with it. And so when he went to the ENT to be checked out, Joanne, it was very much I did not go with him to that appointment, and I didn't think anything about it. I mean, lymph nodes will swell and they will not swell. They go up and down all the time. It's totally normal. And so I will say that the doctor said to him, I believe you have an HPV related cancer. It was called squamous cell carcinoma, P16 positive. And then he looked at him and said, make sure you tell your wife that this is not, that you were not promiscuous or that you had not cheated on her. And I thought, it was an odd thing, because my husband came in and tells me that they think I have cancer. Oh, and FYI, he wanted to make sure you knew it wasn't because I cheated on you. And I thought, I don't even know what to say to that, And so I think that's where there's such a misunderstanding. And for him, Joanne, there was so much embarrassment around HPV related head and neck cancer. And I think it's unfortunate.
Yeah, it is. And the other part of that statement is the fact that everybody will have one or more HPV infections in their lifetime.
Yep.
But I need to come back again and visit you two ladies, and we need to have
Yeah.
a segment just on this because it is a really fascinating topic. But the other thing that happened was in the midst of this, we lost my cousin at the age of 45, who was a fitness trainer. It was a horrible, horrible loss for our family. So that was just part of it. But there's so many other people have come into my life since then that have been afflicted the same way. There is no stigma.
No, and I think that's the more that you break the stigma through normalizing the conversation around it. And I think normalization, we just have to get comfortable with things that are not polite conversation.
Exactly.
And I'm sorry if that's not polite, then we're just going to go. Let me ask you this. How did the whole dry mouth education focus evolve?
Okay, so one of the major adverse effects or side effects of head and neck cancer, and especially like look at thyroid cancer. Thyroid cancer is the fastest growing cancer right now of any anatomical site in the body. So when we look at what's happening with thyroid cancer, head and neck cancer, the amount of radiation, any radiation oncologist will tell you that the most challenging area of the body to irradiate is the head and neck. And what is left is a depletion of so much of that healing salivary function that we have. And there, well, we'll talk about it in a minute, but there's so many other things that saliva does other than just make your mouth feel comfortable. But the other thing, CPAP users, take a guess. I want you ladies, I put you on the hot seat here. How many million people do you think in the US are CPAP users? Just take a
Well, in my house, it's 50% because my husband does and I don't. So it's at least 50%.
Oh, you're saying 50% of American households. I'm going to say, I'm going to go broader. I'm going to go a little bit narrower, but I'm going to say 33% of American households, someone in the household uses a CPAP.
Let's have it, Joanne.
Okay, it's 33 million. So 33 million, I don't know how that translates, but
it feels like it's 33%. It's very close. So I'd like to reflect that.
That's a lot of people, though, Joanne.
That's a lot of people.
Yeah, it's an awful lot. So you take polypharmacy, people that are taking one or more medications. There are over, I'm not going to put you through the numbers game again, I promise, but there are over 1,100 prescription and over-the-counter drugs that contribute to this. Plus the chronological enrichment. I never like to say I'm old. I always say chronologically enriched. I love that term. But the aging part of it, the silver tsunami that is headed towards us. There are so many people that just through longevity and comorbidities, other types of disease process, diabetes, autoimmune diseases, Sjogren's, all of those are huge contributors to dry mouth. So it wasn't just the cancer part of it, the head and neck, that got me tuned in. But then I realized, man, there is a problem out there. There are so many people struggling, and there are not a lot of good solutions. That was discouraging. So I started delving into it, talked to oncologists, talked to patients, and tried to come up with, okay, what are some of the secrets to success?
All right. Secrets to success. So here's my question. What does the public need to know about saliva? Because I feel like the whole series we've been talking about saliva. So what is this, Joanne? Like, what is this?
Okay. So it's not just spit. Okay, so I have to ask you one more question. On average, how many cups of saliva does a person manufacture in a day? Just take a wild guess. You didn't know I was going to do this, Judy, did you?
I love this game.
I know I do too. Anybody else have a guess over there in the chat?
I think there's
Anybody want to put something in the chat?
Yeah, I think if you guys, and if I see you guys in the Q&A, so we can see you there. So if you're writing through Q&A, I'm looking back and forth. So don't worry, guys. I got you, boo. Okay.
I see 4 cups.
I've got a couple of people. The Q&A works. So guys, if your chat for some reason is not being friendly, go to Q&A. I'm going back and forth. And okay, no problem.
8, 2, 5.
Ooh, those are good. I'm going to go with 12.
Okay, we got some good critical thinkers in here, and I think we've got some healthcare professionals that are weighing. It is actually between, on average, 2 and 6 cups
Oh, I feel like I
a
totally
day.
guessed.
But what does that saliva, what does that, you make me laugh. What does that saliva do? That saliva heals. There's something called salivary epidermal growth factor that actually heals if there's an ulcer and heals the esophageal area, heals the GI. There's digestion, there's metabolism or breakdown of starches and fats that really help. And there's also the buffering compound that takes us from an acidic environment, which can be extremely dangerous when we have that acidic environment throughout our whole body. And it's part of our immune system. And it also has an impact on vasodilation, which is controlling blood pressure, if you can believe it or not. So there are so many things. It's not just spit.
I didn't realize that. Like, I think it's the breaking down of things, but how it really impacts. I think, and I just keep thinking, I'm like, why would we have learned more about that in school? Like, I don't feel like this is new.
No, it's not. It's not new. But I think because of what's happening in our world when we look at diabetes, which, dry mouth is going to be one of the first signs clinically. We look at autoimmune disorders, and we just go back to that longevity of our population in today's world. We're seeing a lot more of it. So it's on our radar, maybe much more. And plus, in today's world, we're talking about stuff. And with social media and everything, everything's out there. So much more than it used to be as well.
I'm going to agree with that. I'm sorry, Jay, I didn't mean to talk over you, which
fine.
normally happens to everyone. FYI, I talk over Jay all the time. But I think that's probably the interesting thing. I'm going to throw out a number at you. Fastest growing age group in the US right now is 85 and older.
I know.
So FYI, in case folks did not know that, fastest growing age population. And so one of the things, because we do caregiving, Joanne, there is the data is supporting that there will be over 75 million unpaid caregivers who are supporting individuals by 2030. And I think about that, and that is people who are living longer. And I think about, as I get older, you mentioned the 1,100 medications, and I know what my mom takes. I knew what my grandmother takes. Like, I am practicing taking all my vitamins. So I don't know if there's any vitamins that you're aware of, Joanne, that make, is it to try to help with deficiencies? If there's any of that is going to create that, or what else I can do. I know we've got like lots of really great, actually, now it goes right into my next question. Like, what are treatment recommendations or approaches that you would recommend to combat, whether it's medication or CPAP or any of that?
Well, I'm going to highlight a few of them, and let's go from the really simple to the more complex.
Okay, I'm ready.
Really simple, like a humidifier, of course. Sips of water, of course. But what does sips of water mean? Trips, sips equal trips, right? Sips equal trips to the bathroom. And a lot of people don't like that. So even something so simple as just having ice chips. Instead of having a sip of water, that ice chip that stays in the mouth for a longer period of time and gives more relief for a longer period. Another thing that's really interesting that a lot of people do, that I found when I was working with survivors, is mouth taping. That you actually using, there's a product by 3M, micropore strips that they put over the center of their mouth. So it still allows breathing through the mouth, but it directs them subconsciously to breathe more through the nasal passages. And then to complement that, a breathe right strip over top of the nasal passages that helps to open that up. So that gives you more benefit than having open mouth type of breathing, which it really, really dries out the mouth so quickly. Simple things like coconut oil. Coconut oil is another natural type of thing that you can use, larger amounts of, and that can sometimes be more soothing to the oral cavity as well, and to the mucosa, to the tissue. Baking soda, a teaspoon of baking soda, a teaspoon of salt, or half a teaspoon of baking soda, half a teaspoon of salt, and a cup of water, and using that to rinse with. That is really important to get that pH in the right position, so that you're not actually having an acidic environment all the time to deal with. And I want to talk about that. I know I'm watching my time here,
but
as
fine.
we get to the close. But those are the simple things. So I've got all my little goodies over here. So Xylamelts, we talked about those. Somebody touched on those the other night. So what that is, Xylamelts, they come in this little package and you pop them out and they've got an adhesive backing on them, which goes against the tissue. And the tip here is to place it on and not keep pressing on it. Just place it on and move away from it. You don't have to keep, playing with it. It will adhere. What these do is they release, this is a time release, so you can use 2 of them. The only place you don't put them is on your palate, but they can go on the outside of the molar area. They time release xylitol. So it's a slow release. So what's so good about xylitol? Xylitol starves the primary bacteria that causes tooth decay. And when we have a dry mouth, we're really, really susceptible. So Xylamelts at nighttime, rather than, like a lot of seniors will go and get a mint or something, one of those Scotch mints, put it right in here. And that's just the worst thing you can do. So that's a real tip. I do want to talk about power toothbrush versus manual toothbrushes. There are great manual toothbrushes. They're dental hygienists, most of them, but there are some others that are quite good. This is a Curaprox, Curaprox, and this is a 5460. What this means is there are 5,460 bristles in this head, and I wish everybody could feel this. It is super soft. It's actually called an ultra soft. So these are used for somebody that is going through dry mouth that maybe is a heavy-handed brusher, because a heavy-handed brusher in an oral environment that is acidic, it's like running a hot knife through butter. It abrades the enamel and the root even further. So fast forward to power toothbrushes. This is the Philips Sonicare. What this does, this has smart sensors in it. So if I turn this on and I pressed it against my hand, I don't know whether you can see it light up there. You might not. You probably can't. Yeah. But it lights up, and that tells you that you're putting too much pressure. So that's one thing that's fantastic about a power toothbrush. But the other thing is, it has 31,000, I'm not going to play the numbers game with you ladies. I've got that. It's kind of, I got obsessed with it in the beginning, but I'm getting over it. So 31,000 brush strokes in the 2 minutes of brushing. Do you know what that equals? If we compared that to a manual toothbrush, that equals a whole month of brushing. So that is hugely, hugely significant. The other thing, as a caregiver, I know through losing like 4 parents and a step parent, I know how helpless you feel at times. You just feel powerless, useless, all the rest of it. A power toothbrush gives you the ability to get into those hard to reach areas, and it does the work. Also, with some of the smart sensor technology that is built into some of the models, not all of them, but some of them, many of them, it actually has an app that will give feedback into areas that you could be missing as well. So for a caregiver, that's amazing. So that's all good. A lot of those areas can be self-cleansing with the tongue, but if you don't have saliva, it's not going to be great. So the other thing that I've got here, I don't want to spill this because this is my little secret tool here. This is
we have that
power flosser. Do you not love that?
Yes.
So this it's the power of the X. It's quad stream technology. So it comes out with 4 quad streams and goes in between. And that's where a lot of the problem starts with cavities, periodontal disease, gum disease, because bacteria gets in between the teeth. And the Sonicare has fluid dynamic force that will push through, but that also is a huge complement. So those are things that a caregiver can use that are so, so, so helpful. I can't stress that enough. What else was I going to mention? Toothpaste, there are different toothpaste that can be used. What else am I going to mention? I do want to check my notes because I don't want to forget anything that was so important. The other thing, and obviously one of the most important things that I do want to talk about is rinses and oral sprays and gels and all those types of things. It wasn't until a few years ago that there was an incidental finding with my health. It was a simple thing, not life-threatening. It was an arrhythmia, but I had to go on a beta blocker. And I never realized what cotton mouth actually felt like. So I tried all of the different, most of them are water-based that are out there. And finally, I did find through a company I was working with, I found my Aquarel, which is part of our, our major sponsor for this. But I do want to share a personal story with this. Sure. This was something that I started lecturing about because I can't talk about anything that I'm not passionate about. What's the competitive differentiator? It's lipid-based, meaning it is more of like an oil-based. It moistens, it lubricates, it actually builds up a barrier. And what that allows is the tissue to heal that has been traumatized by a really, really dry environment. So the actual, if you want to go to the science a little bit, the cellular architecture becomes stronger and more impervious to damage. But this, I wish I could spray this right now into everybody's mouth so you could actually feel the difference. You can feel the oil in it. It just has a completely different feel. And it's discreet. It's easy to carry around. There's no rinsing. There's no mixing. It's super, super. But what happened, again, a personal story, and as an educator, I really, really wanted to have the opportunity to be able to stand up there at the podium and give my colleagues something that really worked. Because that's an awful feeling if you're up there and you're thinking, okay, they are making recommendations to their patients and they don't have things that work really well and they're feeling helpless as well. All of a sudden, because of a business model, it went off the market. I'm like, what? What happened? It's gone. It can't be gone. It was making a difference. I was getting great feedback, using it myself before I spoke for 6 hours. I would use it throughout the day. It was awesome. All of a sudden, Dr. Mike Milligan, just a gem of a guy. And he is a cancer survivor and really struggled with dry mouth. He said, it's back. Aquarel is carrying it. So I know I can see a few questions there, and everybody, thank you very much for putting the name in. So it's on the screen there, on Natalie's screen and also on JJ's screen. But I am so thrilled to have it back. My sponsors that are on here tonight are not because they came after me. I went after all of them. I went to the Oral Cancer Foundation. I went to Bellscope. It's saving lives. I went to Aquarel because I wanted to work with them because I know it works. So that's the story behind that. So I am super, super thrilled that they brought it back on the market. And one of the things that happened, because it was available through an online pharmacy, is all of a sudden the people were going to the online pharmacy and saying, what happened? This was working for me and now it's no longer available. Why did you do this to me? So, I like things that have differentiators that are solutions.
Well, and I know some people have asked about how they can get it because it's not over the counter. I know it is prescription, and so you just have to request it. And I know we'll have instructions with the link when I give you guys the link. You'll get that tomorrow for sure. And then I know JJ's maybe look at the link and throw that in there if you don't mind. So we'll make sure you guys have the link either way to learn more about that. I've tried Aquarel as well because my husband tried it, and I wanted to see what it was like. It's anybody can use it. And it definitely was very different because I feel like if he tries it, I should try it. So I get a sense of what that's like in my own mouth. And so I can tell you, there is a noticeable difference between water-based and lipid-based. I know we're getting close on time, but I know we're going to go over a little bit since we had a couple of issues there. So I know we have one more question. Jay, do you want me to jump on that? I know you're responding.
Yes, just really quickly, because I think I know what that may be. Go ahead.
Yeah.
Go ahead, Natalie.
Yeah. So can you comment, and this is really important because I saw this in your bio. Let's talk about the importance of screening to improve patient outcomes.
Okay, so a couple of things. And again, I'm going to go to my little tools here at the side. But a couple of things that are really, really important. So, if we're talking about HPV and oropharyngeal cancer, Velscope. If you want to learn more about Velscope, go to velscope.com and you can actually find out who is a registered user in your area. But let's talk about dry mouth. Dry mouth, medical professionals and dental professionals need to be screening for this. And it's so easy. I love this. I know as a dental hygienist, I'm always very mindful that we don't have a lot of time in our appointments, but all you do is you grab the lower lip and you pull it right down. I'm going to do it, okay, like this. And you look in the mirror. And if you have one of those magnifying mirrors, you wait for little droplets to form on the little orifice, the little opening of all the minor salivary glands that are inside your lower lip. If it takes more than 1 minute, you've got a very low resting rate of salivary flow. If it takes 30 to 60 seconds, that's pretty average. If you have droplets appearing in less than 30 seconds, then that's awesome. But this is, again, like related to a lot of the autoimmune disorders. So as a medical, a dental professional, we should be doing this quick test. If we detect that the person does have a dry mouth or we get that feedback. The other thing that's super important is pH, pH, pH. Now, I wish I had some of these, but I just did a workshop. So this is the bottle, pH ion. They're like hot tub strips, but don't use your hot tub or your sauna strips, okay? But they're the same darn thing, basically. There's a little guide, a visual analog, or not visual, and not an analog, but a visual metric here on the side that tells you what pH you're in, because the majority of us are walking around in a demineralized zone, which is not good. The other thing is this pH paper. So this can be used at home. And then what do you do about it? Xylitol. Xylitol is one of those things that is so important. So 3M has them, Spry has them, they're mints, they're pastilles, they're gum, all those different things. Again, that starves that bacteria that causes tooth decay. So pH is so, so important. So yes, we can do screening and we can have collaboration between dental professionals and medical professionals. That is so important. I'm going to shut it down because if there's questions, I want to make sure we have time for it.
Absolutely.
I'm happy to stay on a little bit longer. I know we're at the 7:30 mark, but whatever everybody's happy with.
All right, so I know there's a question about, is a coral available in Australia? And I think it's not at this time. I know we have a representative on there. So Ellen, if you wanted to jump in on the chat, you can answer that on the chat. I think it's right now just in the US and other questions. Okay, I see only available in the US for now. So just available in the US for now. So they're working on it. They're working on it. Other questions that we have, I'm looking in multiple places.
I can help you there too.
Yeah, no. Let's see. How much xylitol? Oh, that's a good one. How much xylitol is too much?
Okay, great question.
That's a good question.
Great question, because a lot of time people talk about GI disturbances with xylitol, and that is true. The other thing, as a dog owner and a pet lover, you have to keep it away from animals. So I'm not talking about pure xylitol. I'm talking about even over-the-counter gum that has xylitol in it, because a dog can't metabolize it. But the recommendation, the therapeutic impact, is to be recommended after a person has a beverage, anything with sugar in it, after any meal, after any snack. So it would literally be about 4 to 7 times a day. And that is way below the threshold of causing any GI disturbance. The main thing that's important, though, is a therapeutic dose is 1 gram. So that would be 4 to 7 grams a day. And if you go to some of the over-the-counter products, they're mixed with xylitol, sorbitol, mannitol, because they're cheaper to manufacture. You're not guaranteed that you're getting that therapeutic dose. So it's important to really make sure that you go with a product that you know you're getting a full gram.
Anne, I see your question. Do you recommend fluoride in trays at night? And if so, how often, if you have she has fried, and I understand the fried and burned up salivary glands, and therefore
Yeah.
very dry from the radiation therapy. So
Yeah.
fluoride trace.
And that's something that the oncology team will be best versed to answer, but definitely there are other alternatives that you can use in the fluoride tray. You can use some of the prescription ones like Clinpro 5000, Prevident that have a prescription strength, but not as high a concentration, because you have to remember too, in the fluoride trays, you're ingesting as well. So that's why I tend to be a little bit more cautious. And also the other thing, there are other remineralization toothpastes out there that are great with calcium and phosphate in them. And that's what makes up the matrix of the tooth enamel that makes it really, really strong. So yes, fluoride is a first line defense for being able to mineralize, but you don't have to go just with fluoride. Those that would rather go with a product that I hate to say natural versus unnatural, but some people would rather stay away from fluoride. So that's where the calcium and the phosphate type of toothpaste come in as well.
Yeah, we had the choice between trays, and we chose Previvent because our physicians at the oral folks up in New York had recommended, said one or the other, and for Jason it was just, this was easier for him to work with.
Yeah. And you know what? Once you get oral mucositis happening, which is like a canker sore for any of those who are listening tonight that have had a canker sore, imagine having them lining your mouth entirely and all down your throat, like 75 to 100 of them. You don't want to be putting anything in your mouth. And that's where that Curaprox, the Ultra Soft in that condition would be the superior choice.
Yeah. I see another question in here on the chat side. Have you, it says, ever had an allergic reaction to xylitol? Patient broke into hives of xylitol chips. Could it have been flavoring? And then, of course, remind me of the name of the tablets we put in the cheeks again. Oh, I see JJ did Xylamelts. Okay.
Yes.
Question about allergic reaction.
Xylamelts is the name of those. And let me just put that up there again.
Perfect.
See it clearly. Anyway, yes, you have to be careful with allergic reactions because it could be some other byproduct that is within the makeup. So until you actually get checked, you don't know whether it could be the flavoring or it could have been the xylitol. For myself personally, no, I haven't heard of a xylitol allergy, but I'm not saying that. I'm always very, very careful. Unless I know a definitive answer by science, I'm not going to give a positive yay or nay, but I would assume that it would be best to get everything tested.
And I've got one more question and then we'll let you go, folks. If there are more questions, we'll make sure to get those to Joanne and we will send those out after. I appreciate your all's patience as we're just kind of working a couple of screens. Anne had a follow-up to the fluoride trays, and she said, would the products or the items that you recommended, would these be recommended for patients with dry mouth and permanent appliances like implant dentures?
That's
a good question.
Yeah, it is a very, very good question. I cannot see why there would be any contraindication at all. Because again, we are trying to reinforce the foundation. When we're talking about implant dentures, we are reinforcing the foundation that the 4-on-4 is built on. So I can't see where there would be any contraindication to it, particularly with the strength of the materials.